This PowerPoint contains few important question and answer for NCLEX licensing exam. The most of the question in this PowerPoint about the maternity and neonate. The first question here, which situation should a supervisor consider in making assignment for the nurses in neonatal unit? So number one, a pregnant nurse should not care for a neonate whose mother was positive for human immunodeficiency viruses. Number two, a nurse with young children should not care for neonate whose mother has gonorrhea. So number one and two is sexually transmitted infection. Definitely we need to blood contact or body secretion, right? So if a pregnant nurse give the care for HIV or mother who have gonorrhea, is there any chance to spread to the mother? Maybe no. Number three, the nurse with the young child should not care for a neonate with a erythema toxicum. Number four, a pregnant nurse should not care for a neonate with a cytomegalovirus. So the answer is number four, a pregnant nurse should not care for the neonate with a cytomegalovirus, or shortly called CMV. So Rationale said the CMV exposure can affect the fetus. So women who are pregnant should avoid contact with the CMV positive client. So in this picture, we can see this is actually not a CMV. It is neonate ophthalmic infection. Let me finish first CMV. Cytomegalovirus is a common virus that infects the people of all ages. Over half of the adults have been infected with CMV by age of 40. Most people infected with cytomegalovirus but does not show any sign and symptom of the disease. But CMV can cause the major health issue if the client are immunocompromised, immunosuppressed, HIV and AIDS, or organ transplant, or if immunity is really bad. That time CMV can cause a big problem. When a baby is born with the cytomegalovirus infection, it is called congenital CMV. Now go for HIV is transmitted via blood and blood product. All staff should take the contact precursor, and we could follow the standard precursor. When a mother has gonorrhea, the nurse should administer eye prophylaxis to the neonate to prevent neonatal ophthalmic infection. It is not a concern for the staff. Erythema toxicum is a common rash in infant, and communicability is not a concern. So, only pregnant nurse should not care for the neonate with a cytomegalovirus infection. As I told you, If mother has a gonorrhea and this baby have the ophthalmia neonatum because baby is infected from the mother through the delivery processes. So ophthalmia neonatum refer to any conjunctivitis occur in the first 28 days of life. Originally, the term neonatal ophthalmia, we refer to conjunctivitis in newborn and caused by Neisseria gonorrhea. So antepartum lab investigation is very important, right? So next question here. A two-day-old neonate has not been eating well and is irritable and has a temperature of 101 Fahrenheit auxiliary. The nursery nurse anticipate that the physician will most likely order which test, right? So fever, irritable, and has not eaten well. Maybe my baby is sick. When temperatures go up because of infection, inflammation, we need to evaluate. So what should be the ideal test? Like cytomegalo, CSF, cerebrospinal fluid analysis, blood culture to find out what organism and antibiotics need to give, and also complete blood count, shortly called CBC. So WBC should be go up, indicate infection, particular neutrophil. Urinalysis, blood culture, and throat culture, CBC, and arterial blood gas analysis. So out of 4, which is the most important? Let me explain. Number 4, CBC is important, but this patient does not need arterial blood gas analysis. So number 4 is not an answer. Blood culture and throat culture. So blood culture is okay, but it is very early stage to go for throat culture. And right, because patient is a fever, eating, it does not eat, and irritabilities. Urinalysis is important, but most important is CBC, blood culture, and also cerebrospinal fluid examination or analysis. So correct answer said number 1. Cerebrospinal fluid analysis, blood culture, and complete blood count. Rationale said the neonate is exhibiting sign and symptom of sepsis. What are the sign and symptoms of sepsis? Body temperature go up or fever, irritabilities, and does not eat well. It is the indicate the pediatric sepsis. So every student must know pediatric sepsis symptom, diagnosis, and treatment. It is very severe inflammatory response in a newborn baby that can cause tissue damage and organ failure. So neonate exhibit sepsis. Effective treatment of sepsis cannot be irritated until the cause is identified. The physician will most likely order CBC or obtain CSF and blood culture to help identify the cause. Urine analysis would indicate whether a urinary tract infection is present or not, but it would not identify the cause. A throat culture would indicate if the neonate has a throat infection, but does not give any additional information about the extent of infection. Arterial blood gas analysis is not necessary for this neonate at this time. In this picture, you can see what are the major sign and symptom of pediatric sepsis, right? So if you see any sign symptom like this, it indicates patient has a sepsis. And the symptom can be subtitle or might involve fever, lethargy, nausea, and dizziness. So you can see body temperature more than 38.5 degrees Celsius. Increase the respiratory rate, heart rate, respiratory rate increase, heart rate increase, inappropriate tachycardia, altered the mental status. So patient feel the irritabilities, lethargy, and sleepiness. For prolonged capillary refill, it should be more than 2 seconds, or have a lower threshold of suspicious for patient younger than 3 months, or chronic disease, recent surgery, or immunocompromised. They have a chance to develop the sepsis. So I always request student before go to the board exam, it is good to know what are the signs of sepsis. Keep it note, the sepsis patient a chance in mental status, confusion or altered mental status. And also we have to check the respiratory rate or breathing, and it is very fast breathing, maybe the early sign of sepsis. And in general, the symptoms of sepsis can include fever, chill, confusion or delirium, or fever or low body temperature, hypothermia even, light headache's due to the low blood pressure or rapid heartbeat, right? Even skin rash. What next? Question: which statement described the rationale for administering vitamin K to every neonate? Number one, neonate do not receive clotting factor in utero. Number two, neonate lacks intestinal flora to make the vitamin. Number C, it boasts the minimal level of vitamin K found in neonate. Number four, the drug prevents the development of phenylketonuria. So correct answer is number two. Neonate lacks the intestinal flora, make the vitamin K, right? So why you give vitamin K to your neonate? Because their gastrointestinal system is sterile, right? No bacteria flora, and bacteria flora can produce vitamin K. Rationale said neonates are at the risk for bleeding disorder during the first week of life, because their gastrointestinal tract are sterile at birth and lack the intestinal flora needed to produce vitamin K, which is necessary for blood coagulation. Vitamin K stimulates the liver to produce the clotting factors. Vitamin K does not prevent PKU, phenylketonuria, which is an inherited metabolic disease. Next question here. A nurse is caring for a full-term neonate who is 24 hours old. Assessment findings including auxiliary temperature 96.8 degree Fahrenheit. If you convert it to Celsius, it would be 36, and it is normal. Apical pulse rate is 188 beats per minute. Respiratory rate is 48 beats per minute. And the mother report that the neonate is lethargic when she tried to breastfeed and looked like a rag doll. The mother also has a low-grade fever. Pulse oximetry revealed saturation of oxygen 89% on a room air, and the neonate has a ducty mucous membrane. So what are the most appropriate nursing intervention? Select all that apply. So number one said, encourage the mother to breastfeed because the neonate is becoming dehydrated. Number two, observe the neonate carefully and contact physician and explain her suspicious of early neonate sepsis. Number three said, provide blow up oxygen and monitor the neonate respiratory status. Number four, keep the neonate in nursery, monitor the vital sign every 2 hours, and inform physician of neonate status when he makes the routine in the nursery. Inform the parents that she wants to monitor neonate closely. The correct answer said number two, observe the neonate carefully, contact physician, explain her suspicious of early neonatal sepsis. Number three, provide the blow-up oxygen and monitor the neonate respiratory status. And number five, inform parents that she wants to monitor neonate closely. The rationale said the neonate's symptoms are consistent with early onset of neonatal sepsis. The oxygen saturation, respiratory rate, and cyanosis indicate that the neonate needs immediate oxygen supply. Because saturation of oxygen 89%, it should be 95 to 100. So the nurse should contact the physician immediately and continue monitor neonate closely. Tachycardia or tachypnea also indicate that the neonate is compromised and may deteriorate rapidly. Keeping the parents informed at this time is important and support the mother by acknowledging her concern. And there's no evidence that the cause of neonate problem is dehydration, right? And neonate condition take vital signs more often than every 2 hours. Next question here. umbilical cord prolapse necessitated cesarean birth of the preterm. So a baby is a preterm and went through the cesarean section because of cord prolapse. And low birth baby, immediately after the birth, the neonate is limp and gripping for air, unresponsive to stimuli, and has a blue discoloration of face, lips, and torso. Which intervention should the nursery nurse perform first? So number one, establish the IV access through an umbilical venous catheter. Number two, initiate the cardiac compression. Number three, administer low flow oxygen through a nasal cannula. Number four, determine unresponsiveness and assess the need for resuscitation. The correct answer said number four, determine the unresponsiveness and assess the need for resuscitation. So in this picture, you can see this is the umbilical cord, right? And here is this came through the birth canal before delivery of the head of the fetus. So umbilical cord prolapse means the umbilical cord is flexible and it is tube-like, right? Structure that during pregnancy, it is connect the fetus to the mother. And umbilical cord is the baby's lifeline to the mother. And it transport nutrient to the baby and also carry away the baby's waste product, right? Sometimes NCLEX board asks a question, how many artery and vein contain the umbilical cord? It is made up of the 3 blood vessels, 2 artery and 1 vein. So when umbilical cord is prolapse is a complications that occur prior to or during the delivery of the baby. In a prolapse, the umbilical cord drops through the open cervix into the vagina, and also this came out before baby's head delivery. And sometimes the cord can then become trapped again the baby's body during the delivery. And umbilical cord prolapse occur in approximately once in every 300 birth. So it is the very danger of the baby. In the delivery, the fetus can put stress on the cord, right? So rational said the nurse should determine the unresponsiveness and assess the need for resuscitation. If resuscitation is necessary, the nurse should initiate it immediately, and after addressing airway or breathing and circulation, the nurse should establish IV access, right? And oxygen should be administered through the bag valve mask, not a nasal cannula. It may be necessary to begin the cardiac compressions depending upon the neonate heart rate. So, next go. So here we can see something more. In the previous question said, blue discoloration of the face, lips, and torso. This is called cyanosis. You see, this is the blue discoloration of the lips. Here, it is called cyanosis, central cyanosis. But ectocyanosis, sometimes blue discoloration the tip of the feet or tip of the hand, and it is the normal. So ectocyanosis is a painless condition where the small blood vessels of the babies is constricted or turning the color of hands and feet bluish. The blue color comes from decrease the blood flow and oxygen moving through the narrowed vessels in hand and feet. Ectocyanosis is common in newborn, and most other cases occur in teen or young adult, but I think it is common. But central cyanosis or peripheral cyanosis is not common. So central cyanosis means increase in arterial deoxyhemoglobin. It is associated with decreased pressure of oxygen or hemoglobin oxygen saturation, right? And peripheral cyanosis involve the blue discoloration in the skin, right? Next question. While receiving a phototherapy, a neonate begins to have a frequent loose and watery green stool and is very irritable. The nurse interprets this as which situations? Number one, this is normal adverse effect of phototherapy. So if I ask you, what is phototherapy? So phototherapy is a light treatment, particularly, right? So number two, neonate is developing lactose intolerance and need a soya-based formula. Number three, bilirubin is raising to dangerous level. Number four, neonate may have a malabsorption problem. Correct answer is, this is a normal adverse effect of phototherapy. So in this picture, you can see a baby under the phototherapy. Phototherapy is a light treatment for newborn jaundice. Jaundice, what is jaundice? Jaundice is yellow of the newborn eye or skin because of high bilirubin level, right? So what are the underlying causes of jaundice? It is a caused by too much bilirubin in the blood. And bilirubin is a yellow substance and we found in blood cell. So phototherapy is a treatment. So rationale said phototherapy increases the gastric motility, causes the neonate to have a mini green water stool. The increase the gastric motility also causes the neonate to be irritable, and there is no evidence that the neonate has a lactose intolerance or malabsorption problem, nor is the three evidence that the neonate's bilirubin level are raising to the dangerous level. What next? Next question here. A neonate has a imperforate anus or tracheoesophageal fistula and also single umbilical artery. The nurse suspects that the neonate has what medical condition? It's called black with syndrome, trisomy 13, Turner syndrome, or better association. So your client or baby have imperforate anus, tracheoesophageal fistula, and also one umbilical vein. So when these three symptoms together, we call better association, right? Imperforate anus. What does it mean? Imperforate anus is a birth defect. So let me show this picture. So this is the normal anus, but here imperforate anus. As I told you, imperforate anus is a birth defect where the opening to the anus is missing or blocked, right? And also they said tracheoesophageal fistula. What does it mean? So you can see this is the esophagus and this is the trachea, but this is the abnormal connection between esophagus and trachea. It is called tracheoesophageal fistula. So we can see here different kind of tracheoesophageal fistula. In the first picture, we can see this is the esophagus continue to the stomach, and this is the trachea, right? So tracheoesophageal fistula is a abnormal connection between upper part of esophagus and trachea. So you can see this one, it is called atresia, and this lower part attached to the trachea and fistula formation, and is called atresia with distal fistula. Here we can say atresia double fistula, both part connected to the trachea, and this is called fistula and atresia proximal fistula. This is only atresia, no fistula, and here fistula. So tracheoesophageal fistula is a life-threatening condition in which there is abnormal connection between esophagus and trachea. In the first picture, we can see esophagus and trachea run next to each other through the chest cavity. It is normal, but when they're connected, it is abnormal, right? So in this question, let me go back. They said better association when patient has tracheoesophageal fistula, imperforate anus, and horseshoe-shaped kidney. So what are the normal kidneys supposed to be? So you see that this is the normal two kidneys, right? And but if two kidneys is communicate, look like a horseshoe, it is called horseshoe-shaped kidney. So horseshoe-shaped kidney is a congenital problem. So now what is better association or symptom? It is the vertebral anomalies, and patient have a anal atresia, tracheoesophageal fistula, and renal anomalies. What is renal anomalies? It is horseshoe-shaped kidneys, right? So rationale said a better association involves a series of congenital anomalies include vertebral defect, an imperforate anus, and tracheoesophageal fistula, and a single umbilical arteries. Also, renal dysplasia like horseshoe-shaped kidney. Another trisomy 13 or Turner syndrome are chromosomal abnormalities that does not occur with the other defect. So here we go and check the Turner syndrome. So what it is? So Turner syndrome, a condition affected the female due to the permanently or completely missing the sex chromosome. So usually female have to have X chromosome, but if one is missing, they develop the Turner syndrome. So most of them can lead to the normal life with regular medical intervals. So if I ask you what are the symptoms of Turner syndrome? Turner syndrome leads to various developmental and medical problems that vary between, like heart abnormalities. They have a wide neck, ear anomalies, short stature, and also narrow nails or small lower jaws, sometimes high, narrow, and roof of the mouth, low hairlines. So next more, also short stature, broad chest, low hairline, low set hair, increase the obesity, small fingernail, webbed neck, ear infection is common, poor breast development, and also also kidneys. Next question, which action should a nurse perform immediately following the birth of a neonate? Number one, aspiring mucus from neonate nose and mouth. Number two, drying, make them dry. Neonate to stabilize the neonate's temperature. Number three, promoting parental bonding. Number four, identify the neonate. The correct answers say number two, make them dry. Neonate to stabilize the neonatal temperature. The rationale said the nurse's first action after the birth is to make dry the neonate and stabilize his temperature. Aspiration of the neonate nose and mouth occur at the time of delivery, promoting the parental bonding and identifying the neonate are appropriate after the neonate has been dried. So first of all here, when a baby is born, we have to go for newborn assessment. And what are the newborn assessment components? First of all, appearance, right? Pulse, remains, activities, and respiratory effort. And this criteria together is called ABGAR score. So ABGAR is a quick test performed on a baby at first minute and 5 minutes after the birth. So 2 times we can measure, 1 and 5. In the 1 minute score, determine how well the baby tolerates the birthing process, and 5 minute score tells the doctor how well the baby is doing outside the mother uterus. So ABGAR score, a measure of the physical condition of a newborn infant, and it is obtained by adding points, right? So you can see the activities, muscle tone, pulse rate, also grimace means reflects irritabilities, appearance, skin color, and respiratory rate. So we have a point for heart rate, point for respiratory effort, muscle tone, and also response to the stimuli. If all is absent, they will get 0 point. Like if the activity muscle tone, arms and legs fixed 1, if it is active movement, 2 points, right? So a score usually of 10 represent the best possible conditions. So they said severely depressed if the scoring is 0 to 3, moderately depressed if 4 to 6, excellent condition if the score should be 7 to 10, right? So first of all, before to go next question, I want to tell, if you ask me what are the EBGA scoring or score and why are they are important. So EBGA score describes the health of a newborn right after the birth. And healthcare provider use EBGA score to help the guide them in caring for the newborn right after birth. The score tell the healthcare provider if a newborn needs in special care, such as extra oxygen or not, right? And you can see here is the 5 criteria. So 5 criteria we use to determine the EBGA score. So the EBGA score is determined by evaluating the newborn baby on 5 simple criteria on a scale from 0 to 2. So 0, 1, and 2. Then we summing up the 5 values, right? Thus obtained. The resulting score range from 0 to 10, and the 5 criteria are summarized using words chosen to form a, I think used to easy way to say, appearance, pulse rate, grimace, activities, and respiratory effort. Next question. A nurse just receiving the shift effort. Which unit should the nurse go an assessment first? Number 1, 4-hour-old neonate with jaundice. Number 2, 2 days old neonate in an open bassinet, and 6 days old neonate in a isolate dose gestational age assessment place him at 36 week gestation. Number 4, 12-hour-old neonate who is small for gestational age. So out of 4, number 1, 4-hour-old who have a jaundice, we should go and check first. Restaurant said the nurse should assess the 4-hour-old neonate with jaundice. When jaundice occurs within the first 24 hours of life, it typically indicates a life-threatening disorder, such as sepsis, hemolytic disease of the neonate, RS incompatibilities, or ABO incompatibilities. What is RS incompatibilities? RS incompatibilities is a condition occurred during the pregnancy if a woman has a RS negative blood and her baby has RS positive blood. So RS negative and RS positive refer to whether your blood has RS factor. So physiological jaundice, which is commonly occur later in a benign conditions. A 2-days-old neonate in an open bassinet does not require immediate assessment by the nurse. A 6-days-old neonate, whose gestational age is 36 weeks, is a normal preterm neonate who does not require immediate assessment by the nurse. And also a 12 hours old neonate who is small for gestational age does not require immediate assessment by the nurse. Next question here. A nurse is conducting a physical examination on a neonate at which pulse point on a neonate does the absence of a palpate the pulse indicate possible coarctation of aorta. Number 1, femoral. Number 2, brachial. Number 2, radial. And number 4, carotid. The correct answer is the femoral. Why? With the coarctation of aorta. So you can see the picture. So this is the small duct, is called ductus arteriosus, and this is the arch of aorta. So if the aorta is narrowing like this, right? So it is called coarctation of aorta. So a congenital narrowing of aorta like this, congenital narrowing, right? And aorta is a major blood vessels which carry the blood from heart to the rest of the body. And when defect like this, congenitally, we call coarctation of aorta, also known as narrowing of the aorta. So rationale said, with coarctation of aorta, the nurse should note bounding pulses and indicate blood pressure in the upper extremity, as well as decrease or absent the pulse in the lower blood pressure in the lower extremity. And these findings occur because of narrowing arch of aorta. Next question. A nurse is caring for a neonate with suspected diaphragmatic hernia. The nurse should questions in order for A, chest X-ray. Number 2, max ventilations. Number 3, placement of a orogastric tube. And number 4, immediate endotracheal intubation. The correct answer say the max ventilations. So what is diaphragmatic hernia, right? So a diaphragmatic hernia is a birth defect in which there is an abnormal opening of the diaphragm. So you can say this is the diaphragm, normal picture, but here the diaphragm is abnormal opening here, so the organ from abdomen get in the thorax. So I said diaphragmatic hernia is a birth defect in which there is an abnormal opening in the diaphragm, and diaphragm is the muscle between the chest and abdomen that helps our respiration. When it is opening, the opening allows part of the organ from abdomen move to the chest, right? And definitely it is a defect and causes difficulties Restaurant said the nurse should question an order for max ventilations because this organ push the patient in the lungs and lungs does not expand well, right? So baby need oxygen. This produce may introduce air into the neonate GI tract. An emergency chest X-ray can help diagnose diaphragmatic hernia, and orogastric tube is appropriate because it decompressed the bowel and stomach within the neonate chest. Intubations is needed to ventilate the neonate. So this is few questions and answer for NCLEX board. And if we practice, I believe we will get our license. So keep it note, if you try, you never or you have not failed forever. So maybe you need some help to getting back in your track. So I like to request, please never give up and you will get it.